Hey guys, this is Dr. Antonos. I'm one of the oral surgeons at the Orofacial and Dental Implant Surgery. I'm here in my office in Winter Garden right now. I just wanted to take a few seconds to talk about our anesthesia options. We, as oral surgeons, do a lot of procedures that require anesthesia of some sort, and we also care for a lot of patients that are very anxious or very scared of, obtaining oral and maxillofacial surgery. When you come during your consultation and we evaluate your case, and you as a patient will talk about the anesthesia options along with the treatment options from the oral surgery standpoint. And usually the options fall in three major categories. The first one is where you would be awake and we use local anesthesia. Basically, that's the same thing that you would get when you go to your general dentist to get a filling performed or a crown and so on. And we basically numb the area really, really well. And then the area is locally anesthetized and we can perform the procedure. For some more straightforward, less intense procedure, that's very appropriate in many cases. Now, for the patients that are very anxious about getting this done, we can do a little prescription for a pill that you may need to take the night before and an hour before you come here, so that you can be a little bit more relaxed for the local anesthesia procedure. If you don't think that that may be enough for you, or if the procedure is a little bit more involved, we may also add what we call laughing gas. It's basically nitrous oxide gas, and so we put a little nasal cannula over your nose, and we have a little machine that basically gives you laughing gas while you're getting the procedure performed. That's not going to put you to sleep, but in many cases it will relax you and you will be less tense and nervous than you would be other than that. Now, for the patients that are very nervous or want to be asleep during the procedure, we may choose to do what we call intravenous sedation or general anesthesia. And there's different levels of those. It could be, mild to moderate or moderate to deep, or, general anesthesia. And that kind of depends on the procedure that we'll be performing, the length of time that the procedure requires, and also how nervous our patient is. A factor of this may depend on your medical history, the medications that you're on, and so on. So we will try to determine that during your consultation.